Hello, and today we'll be starting Chapter 1, Therapeutic Exercise, Foundational Concepts for PTA 220. The impact on physical function. So the definition of therapeutic exercise is to remediate or prevent impairments in body functions and structures, improve, restore, and enhance activities and participation, prevent or reduce health-related risk factors, and optimize overall health, fitness, or sense of well-being. Many of the many procedures used by physical therapists in the continuum of care of patients and clients, therapeutic exercise takes its place as one of the key elements that lies at the center of programs designed to improve or restore an individual's function or to prevent dysfunction. Exercise programs are designed by the physical therapist or the PTA and are individualized to unique needs of each patient or client. A patient is an individual with impairments and functional deficits diagnosed by a physical therapist and is receiving physical therapy care to improve function and prevent disability. Here is the multidimensional aspects of physical function encompass the diverse yet interrelated areas of movement performance. Balance is the ability to align segments against gravity to maintain or move the body, which is the center of mass, within the available base of support without falling. The ability of the body to move the body in equilibrium with gravity via interaction of the sensory and motor systems. For cardiopulmonary endurance is the ability to perform moderate intensity, repetitive total body movements, which would include walking, jogging, cycling, swimming, over an extended period of time. Coordination is the correct timing and sequencing of muscle firing combined with the appropriate intensity of muscular contraction, leading to the effective initiation, guiding, and grading of movement. Coordination is the basis of smooth, accurate, efficient movement and occurs at a conscious or an automatic level. Flexibility is the ability to move freely without restriction. Mobility is the ability of structures or segments of the body to move or be moved in order to allow the occurrence of range of motion, ROM, for functional activities, or functional range of motion. Passive mobility is dependent on soft tissue, which would be contractile and non-contractile tissues, extensibility, in addition to active mobility, which requires neuromuscular activation. Muscle performance is the capacity of muscle to produce tension and do physical work. Muscle performance encompasses strength, power, and muscular endurance. Neuromuscular control, interaction of the sensory and motor systems that enables synergists, agonists, and antagonists, as well as stabilizers and neutralizers to anticipate or to respond to proprioceptive and kinesiostatic information, and work in correct sequence to create coordinated movement. Postural control, postural stability, and equilibrium are used all interchangeably with dynamic balance or static balance. So for stability, the ability of the neuromuscular system through synergistic muscle actions to hold a proximal or distal body segment in a stationary position or to control a stable base during superimposed movement. So joint stability is the maintenance of proper alignment of bony partners of a joint by means of passive and dynamic components. The human movement system is the foundation of physical therapy and a focus of physical function. The systems of the body that interact to control each of these elements of physical function react, adapt, and develop in response to forces and physical stresses. So stress equals force divided by area, which is placed upon tissues that make up the component parts of movement. Prolonged inactivity also leads to decreased efficiency of the circulatory and pulmonary systems. Impairment of any one or more of the body systems and subsequent impairment of any aspect of the human movement system, separately or jointly, can limit or restrict an individual's ability to carry out or participate in daily activities. Therapeutic exercise interventions involve the application of carefully graded physical stresses and forces that are imposed on the human movement system, specific tissues or individual structures in a controlled, progressive, safely executed manner to enhance movement and improve the human experience. Types of therapeutic exercise intervention. The individualized therapeutic exercise program is based on a therapist's determination of the underlying risk or cause of impairments in body function or structure, activity limitations, or participation restrictions as identified in the patient examination. You would also determine from other evaluations from the PT, including range of motion or manual muscle testing. Exercise safety. Exercises are performed independently or under a therapist's direct supervision for patient safety. Safety of the therapist also must be considered. Many factors can influence a patient's safety during exercise: health history and current health status, medications, balance, and coordination during exercise or cardiopulmonary response to exercise. Risk factors must be identified and weighed carefully before an exercise program is initiated and might have to also have medical clearance. The environment affects patient safety. Adequate space, equipment must be well maintained and in good working condition and must fit the patient and must be applied and used properly. Exercise affects safety, including proper posture and alignment of the body, execution of the correct movement patterns, and performance of each exercise. And if you would please refer to box 1.1, page 3. And please look over table 1.1, which represents the overview of the ICF. We have already went over the ICF in PTA 101, so please make for sure that you review this again for PTA 220. This is the continuum for the ICF components that you can see in box 1.2. Which includes health conditions, body functions and structures, types of impairments, activity and participation, contextual factors, environmental and personal factors. Which again, these are should all be reviewed from PTA 101. The role of prevention, so understanding relationships among a health condition, impairments, activity limitations, participation restrictions, and the impact of environmental and personal factors on functioning is fundamental to the prevention and reduction of disability. So there's different categories of prevention, and there's also risk factors. So risk factors for disability, please refer to box 1.6. Again, this should all be reviewed, talking about disability and impairments and limitations of daily activities and participation restrictions, so please make for sure that you review those concepts. I will talk a little bit more about the clinical decision making. I know that it was kind of highlighted in PTA 101, but kind of wanted to go a little bit more in depth. So please make for sure that you refer to box 1.7. Requires or contains requirements for skilled clinical decision making during patient management. So clinical decision making is the selection, implementation, and modification of therapeutic exercise interventions. Creative thinking is necessary. We have coordination, communication, documentation. There's also evidence-based practice, which you guys have really went in depth with that last semester, so please refer back to PTA 101 for that as well. We will talk more about the clinical decision making here in a minute. Let's see. So patient management. Here's just the overview for each one of these definitions: intervention, prognosis, diagnosis, evaluation, examination. So make for sure that you review this model as well. So continue a prognosis and plan of care. All of these would be reviewed for you as well, so please refer to box 1.13, 14, 15 for the review for that. And then so for plan of care and goals and outcomes, there's some key questions for goals and outcomes in the plan of care, which is in box 1.14. Intervention. So I'll talk a little bit more about the intervention, since that's kind of what we're really highlighting at the moment. So intervention is a component of patient management. It's a purposeful interaction of the therapist with the patient and with other family members, caregivers, or providers as appropriate. We'll talk more about patient education as well as family education. You, as the PTA, would select, prescribe, and implement interventions based on the examination, evaluation, diagnosis, prognosis, and goals established for the patient. Interventions are updated, progressed, or discontinued based on a patient response, achievement of goals, or results of outcomes. I do want you to definitely look at box 1.15, which is categories of interventions used by the physical therapist. That could include patient or client instruction, airway clearance techniques. Let's see, it could be biophysical agents, functional training and self-care, work, community, social, and civic life education, integumentary repair and protection techniques, manual therapy techniques, motor function training, and other therapeutic exercise. And then if you would please refer to box 1.16, which contains areas of outcomes assessed by the physical therapist. Box 1.17 contains examples and determinants of patient satisfaction. We'll also talk more in depth about measuring outcomes, so which impact of intervention on patient-related functional outcomes and patient satisfaction. So a lot of times they might receive a questionnaire at the evaluation and then during the reevaluation or at different times, a questionnaire to see how much progress that they have been making and how they are improving, or if they have a decline in function. So preparation for exercise instruction. So concepts of motor learning, a foundation for exercise and task-specific instruction. So there's types of motor tasks, conditions and progression of motor tasks, stages of motor learning. So please refer to box 1.18, which contains practical suggestions for effective exercise instruction. And then there's some different pictures and examples as well. Adherence to exercise, so factors that influence adherence to an exercise program, which would be patient-related factors, factors related to health conditions or impairments, program-related variables. Sometimes these are referred to as risk factors. Now we get more into interventions. So here's the different types of interventions that we will be talking throughout the semester. So aerobic conditioning and reconditioning, muscle performance, which includes exercise, strength, power, and endurance, stretching, which will be muscle lengthening, also be doing some joint mobilization to decrease pain, which will be grades 1 and 2. Neuromuscular control, inhibition, facilitation, posture, and awareness. We'll highlight these, but you will be referred to this next semester. Posture control, body mechanics, stabilization exercises, balance and agility training, relaxation exercises, breathing and ventilator muscle training, and task-specific function training, which basically means, let's say that you have a patient that needs to return to a sport, that'd be more task-specific, or a patient maybe that you have through workman's compensation, or maybe you have a work hardening program that you would do task-specific function training to prepare them to go back to work. So goals are very important, which will be established by the PT, and as the patient goes throughout the journey with therapy, maybe the PT might ask you to, while they're trying to update goals, if you have seen this patient primarily. So goals are to allow an individual to resume those roles important to a person's life following an injury, illness, or disease process. So the PT should set realistic, obtainable, and functional goals that are dependent upon the pathological process at work. Must take into consideration how the goals fit into the individual's life and also the pressures that may exist during the person's recovery. So a lot of times the goals will be pertaining to activities of daily living, ADLs, including self-care, communication, mobility, skills, bathing, bed mobility, dressing, eating, grooming, toileting, and transfers that are required for independence in daily living. So what is function? So function would include those activities identified by an individual as essential to support physical, social, and psychological well-being to create a personal sense of meaningful living. That it comes directly from the Guide to Physical Therapist Practice, PTA. Well, the other things to note is everyone does things differently. That includes the patient and the therapist. So this is not a cookie cutter situation with any patient. So that's why it's important to identify not only evidence-based practice, but also your critical thinking as well, because for each therapist might have the program completely different. So that's why it's important to make sure you communicate with your PT and that things are consistent for the patient's plan of care. And this is just a review of common functional tasks that we already have discussed in PTA 101. So if you would want to overview those, transfers and gait.